Welcome to San Mateo County Today. Conversations with government leaders throughout San Mateo County. Here's your host, Marshall Wilson.
Welcome to San Mateo County Today. I'm your host, Marshall Wilson, on location in Daly City. We're here at the Daly City Civic Center. It's a fitting location, as our first guest is David Canepa, the San Mateo County Supervisor who represents Daly City in this area and is also a former mayor here. Next up is Dr. David Young, the new Director of Behavioral Health and Recovery Systems. Thanks for joining us. Welcome to San Mateo County Today. I'm your host, Marshall Wilson, here on location at the Civic Center in Daly City. And I'm joined today by David Canepa, the Supervisor who represents Daly City, Brisbane, Colma, the North County, and San Mateo County. Welcome to San Mateo County Today, David.
Welcome, Marshall, District 5.
Thank you.
Welcome to the best city in San Mateo County and also the largest city, Daly City.
I don't think a lot of people know that Daly City is actually, in fact, the largest city.
Well, they know now, Marshall, and they should know.
All right. I want to jump on into this. I think we can all agree that housing is the biggest issue in the county and in the Bay Area.
Housing is the biggest issue. And in fact, Marshall, when I was mayor of Daly City on City Council, Daly City probably produced the most housing in San Mateo County. When I was mayor, we did about, and it's actually a project right now, around 58 affordable housing units for families. And so that was one of the priorities I had when I was running for the Board of Supervisors, because the amount of housing that we're able to build on Mission Street here in Daly City.
And yet, at the same time, though, you're making somewhat of a name for yourself by taking on some regional powers, including the editorial board of the San Francisco Chronicle, by writing an op-ed saying basically San Francisco and others butt out of housing issues in San Mateo County. The point being, there's a proposal to build, I think, 4,400 housing units in Brisbane, and yet you're saying, no? Where are you on this?
Marshall, we know this, that all politics is local, and local jurisdictions should always have the authority on what they want to do with land use. One, for a couple of reasons. One, it's the foundation of our democracy. It's people-represented government. And two, they elect their city council. So what am I, the largest former mayor of Daly City, the largest city, to go in and tell Brisbane what they should do? And some of them are elected officials, and they're my friends. They're wonderful people. They're trying to potentially pass laws in Sacramento. We have the tech industry basically saying, and these are powerful CEOs, saying, you must build 4,400 units of housing. You have the Chronicle editorial board, which you referenced, saying, you must build housing. At the end of the day, it's not Supervisor David Canepa, it's not the editorial board, it's not the tech industry, it's the residents of Brisbane who should determine their future.
Well, is that an outmoded model at this point, that you have a very small city making a decision that could potentially impact the Bay Area? I mean, so much so you had officials in San Francisco talking about annexing Brisbane. I mean, talk about a hostile takeover.
So an outmoded model is making sure that people who live in their city don't have the ability to vote for their elected officials. I don't think that's an outmoded model. I think that's representative government. But I will tell you this sort of notion that San Francisco is going to annex Brisbane, you know, that is sort of a bit of a stretch. One, I don't think they have the authority to do so. And two, I think it's just, it's a lot of rhetoric with no substance.
So housing, of course, is a controversial issue. Another one you've taken up is texting while people are in crosswalks. Do we need a law that basically supports common sense?
Well, let me put it to you this way, Marshall. When I was a kid, and I'm sure when you were a child, my parents told me one thing. When you walk and cross the street, look both ways. So does it pain me to legislate common sense? Yes, it does. But what we know through data through Ohio State and through the National Highway Safety Council is that there's been an increase in incidents of people getting hit in crosswalks. And in fact, I was in a segment with Stanley Roberts from People Behaving Badly here in Broadmoor, unincorporated San Mateo County. And there was a young woman who has a stroller, but in her right hand, she had her baby, carrying the stroller, and was watching an iPhone movie as she crossed the street. She didn't even know that she was on her cell phone, or that's what she told the officer and I. But what we know is cell phones are with us 24/7. And we know that incidents are occurring, and it's occurring at a high rate. And so what we found out is there's a lot of interest on this. So the Board of Supervisors, we adopted a resolution unanimously, and now the California State Assembly is looking forward to doing this throughout the state. It's governed by the California Vehicle Code. So the action that we took on the Board of Supervisors was to encourage the legislator to take some sort of action. And so this is going to be something that is going to continue to grow. And I mean, remember, it's very simple. Look both ways. And I will tell you this, I do like fining people sometimes, Marshall. And there's a fine for people who behave badly, and the fine can go up to $75. First fine is a warning. $100, $125. And again, it's for people's safety. And I hate to legislate common sense, but on this one, the data shows we had to do it.
Sometimes you have to. I do know that. Not long ago, I was driving down the street and there was a woman pushing a baby stroller. And I happened to just driving down the street and she caught my eye and she's looking at a phone and actually went off, took the stroller off the curb and the stroller rolled into traffic. It was kind of freaked me out a bit. I pulled over, made sure everyone was okay. The baby wasn't hurt or anything, but I think she learned her lesson right there.
Yeah, we might have to have you testify in Sacramento on that. But I mean, it's happening all the time. Yeah. Cell phones are with us 24/7, whether you're getting your calendar, whether it's Facebook, Snapchat, whether it's taking phone calls. That's where we're all at. And so this is a 21st century problem. And what I'm doing is providing a 21st century solution.
Well, and speaking of the 21st century, the internet is everywhere these days, and a lot of commerce goes on the internet. Yeah. Another issue you've taken on is the internet safe zones, and you started that in Daly City and now brought it to the county. What is the whole idea behind these internet safe zones?
Look, first and foremost, we live in San Mateo County is the hub of innovation, the hub of creativity. When you have companies such as Facebook, when you have companies such as Visa, when you have companies such as SurveyMonkey, we as policymakers need to make sure that we're adopting to these technologies, and we have to lead on policy. And so what I suggested that we do, and I will tell you, now it's being implemented throughout the state of California. We now have 4 counties that are adopting internet safe sale exchange zones. And so we took a new facility called Maple Correction Center, have all these high-def cameras, and I always say this, about 100 of your close friends, and your close friends are correctional officers who work in the building. And so we have a spot for buyers, we have a spot for sellers, and these are where these transactions take place. So if you want to buy a phone, you want to buy a phone, you can actually do it in a safe spot. And this was in the light of a Daly City resident who was killed in San Francisco over a Sony PlayStation for $499. A man's life was taken. And so that really struck me. And so we took it from Daly City, we took it to the county of San Mateo, and now it's proliferating throughout the state. But these are the sort of ideas that I'm looking forward to moving with this Board of Supervisors.
Well, and you've been on the board now for about 9 months. And prior to that, you were on the City Council of Daly City. You were the mayor there. What did you expect when you went down to Redwood City, the county seat, becoming a supervisor? And how has that turned into reality, or what are the lessons that you learned in these 9 months?
First and foremost, district elections has really changed the paradigm. I've always been a North San Mateo County boy, 5th generation San Mateo County resident. And my heart is here in Daly City. My heart is in San Mateo County, North San Mateo County. But one thing that's impressed me is the leadership, Marshall, to be honest with you. Probably have the best county manager in the state of California, maybe in the United States. Our pension is at about 87% funded. I've been there 8 months. I'd like to take credit for it, but I can't. So this is all done because we have an incredible board. You look at Warren Slocum. Warren Slocum served faithfully for the county for over 20 years. You look at Don Horsley, former sheriff, served many, many years. So we have this institutional knowledge, and we have Carol Groom. Carol Groom's incredible. She has local government, former mayor of San Mateo. And then you look at Dave Pine, and Dave Pine brings a unique skill set. He worked at Excite at Home, and he worked as a school board member in San Mateo. So we have all these people with all these different skill sets, and it's great to be a part of a group doing wonderful things.
Well, you mentioned district elections, and for the longest time, San Mateo County had everyone could vote for the Board of Supervisors. Then a few years ago, the voters spoke up and said, no, they want district elections. The supervisor has to live in a district, and only voters in that district can vote for that supervisor. How has that changed the dynamic on the board? And as a board member from Daly City, from the North County, are you as concerned what goes on in other parts of the county as before? Because someone in East Palo Alto voted on the supervisor that was from here. How has that changed the dynamic?
It's a total paradigm shift in a sense of how government is implemented. Let me give you a couple examples. Just recently, San Mateo Community College District has voted for district elections. So before, when we elected them countywide, you needed a tremendous amount of resources. And why? You needed to send out mailers, elected officials maybe were able to line up before one candidate because getting into San Mateo, Redwood City might be different. What different district elections did, and let me make no mistake about it, Marshall, and this is how I won, and I'll tell you, is I went to each resident's door probably about 3 or 4 times. And this is democracy, because you know why? You need to explain what your positions are, why you voted on this. And what just district elections does is it brings accountability. So when I walk in South San Francisco, or I'm in San Bruno, or if I'm in Brisbane, they say to me, Supervisor, explain to me why you did this, or I don't agree with you, I don't disagree. And the dysfunction in Washington, it's Democrats, it's Republicans, all that dysfunction is because there's disconnection. There's no connection to their electorates. And so it goes back to what I'm saying. When you're held accountable as an elected official and you're in your district, great things happen, and I'm just an example of that.
When you go to when you knocked on all those doors, and even today, what are you hearing from people? What are their concerns out there, today for people who are, struggling to pay their bills, or they're facing rising rents, or bad commute? What are you hearing from people today?
We've done a poor job in how we treat our seniors. We've neglected them. We've abandoned them. And so what my office has done is we're focused on seniors. We're focused on making sure that the people who took care of us when we're children, took care of us when we're adults, and this is whether you're a rich person, whether you're a poor person, or when you're in the middle. But we're not gonna sort of just neglect you. What we're going to do is we're going to make sure that we take care of you. We've done about 20 workshops on elder abuse. People are seniors, and some of them have been taking advantage of their financial resources. And so what we've done is we've done elder abuse. First county in the state of California, I'm happy to lead this initiative, to talk about the change in Medicare. Before it was your Social Security number. Now what they've done is they've done randomized numbers to make it safe. You can only imagine the identity theft. It's billions of dollars each year. And so this change, we want to make sure people are aware. But if you ask me what I hear in the district, I hear from those seniors who may be living alone, or maybe at our senior centers, older Americans. And these folks aren't frail. Not all of them are frail. Right. A lot of them are living life to its fullest and doing different things. But as a society, let's not forget our seniors. So that's what I hear.
We have time for about one last question, and I want to ask you, you're very active on social media.
Yeah.
That's one way I know you stay in touch with people, and it looks like you and your office have a lot of fun.
Yeah.
Does that ever concern you that we don't necessarily elect our politicians to go have a lot of fun?
Yeah.
And do you ever get concerned, like people think like, well, I want this guy to be working. I don't necessarily want to see everyone out there having fun.
Well, I think the old model of how we do politics has changed. The sort of stodgy, sort of, hey, hierarchical, patriarchal, those days are gone, Marshall. The days we live in now is accessibility, accountability. When I told you about the workshops that we've done, when I've told you, and I haven't mentioned it to you, that we had 500 new people apply for citizenship. It was called the American Experience here in Daly City, where the county spent $725, where I think our total amount was around $800,000 to help them become citizens. And when we're doing all these things to help people, if we have fun while doing it, you know what? Then shame on us. But you know what? You look at the office and you look at our productivity, I would compare it to any office in the state.
All right. Actually, I'm going to slip in one last question.
Sure.
Give me 3 reasons District 5 rocks.
Awesome. I'll give you one. Best food, most diverse, best place to live, best quality of life.
All right. Supervisor David Canepa, thanks for joining us on San Mateo County Today. And thank you for joining us. We'll be right back. And welcome back to San Mateo County Today. We're here on location at the Civic Center in Daly City. Now I'm joined by David Young, the new Director of Behavioral Health and Recovery Systems. Welcome, David, to San Mateo County Today.
Nice being here.
So tell us, what is Behavioral Health and Recovery Services to begin with?
In a nutshell, the department or division, which is a division of the healthcare system, covers our mental health and substance abuse treatment services.
And what drew you here? So you're the new director, you've been on the job, I think about just a few weeks now, correct?
Yes.
What drew you here to San Mateo County? And tell us a little bit about your background.
Okay. Well, I've grown up in the Bay Area most of my life, although I went away for a few years to school, but it's kind of homecoming to come back to the Bay Area.
It's kind of tough to leave, isn't it?
It's it's where home is, where my family is, and where we feel really connected to the community. My parents still live in Oakland, so we came back to help take care of them as they age, as many people of our generation are doing. I have worked in the area for various community-based organizations, mostly in Alameda County, Contra Costa County, and San Francisco County. And so then the opportunity came up to work in the system here in San Mateo. I pursued that, and I was hired to do that.
Well, I'm sure one of the biggest issues you faced immediately was these North Bay fires. And I understand that behavioral health has actually been contributing to some of that disaster relief effort up there. Tell us about that.
Yeah, it's one of the many things we do. Most people think we are only about treatment, but we're also about prevention, and we have a very robust crisis response team. So when the North Bay fires occurred, there's actually a statewide response to that. It's organized through Sacramento, but then the local regional area of county directors, as well as the emergency response, they get together and put out a word in terms of what their needs might be. So our team had been on alert and waiting to see what the needs were going to be. Sadly, as you can imagine, many of the people in the response team in Sonoma County itself may have lost their homes and been going through personal struggles there. And so we were happy to be able to respond, sent about 30 people out to Sonoma County and other surrounding counties to respond.
And what do they do there? When we think of first responders, we think of firefighters, law
Correct.
enforcement, but sort of first crisis responders from behavioral health. What are they doing up there?
Right. So as people are evacuated, either on the streets when they're going through a particular crisis, people will be out there to help with supporting them and giving them counsel. And being able to direct them to resources that they might need to follow up on. And then we'll actually go out to the shelters, evacuation centers, and identify people who might need help and might need to be talked to right on the spot or be referred to services later on.
Is that on a mutual aid agreement, or how does that work? Do you guys just mobilize?
Among counties, there is a mutual aid agreement, and so we don't have to worry about how are people going to get paid or what's, so they don't have to worry about that. They can get out there and just do their jobs. And then we work that out among the counties afterward.
Right.
Some people, of course, can also just volunteer and go on their own, but we may or may not necessarily hear about that except through the supervisors.
So we are here up in North San Mateo County. So tell us about some of the unique behavioral health and recovery services needs up here,
Okay.
and mental health needs up in the North County.
Certainly. So as you may know, mental health, substance abuse issues don't have any difference in terms of age, background, socioeconomic status, and so the same around the country. About 1 in 4 people will have some sort of behavioral health or substance abuse condition that needs treatment. That said, over half of the people don't receive any kind of treatment at all. And so we are working toward that challenge in San Mateo County as well, to try to provide greater access to services, helping people be more aware that help is available and that treatment works if you can get in there, especially at an early stage. And to try to help overcome the stigma. Some people think there's a judgment about folks that might struggle with these conditions, so helping them to overcome that stigma is part of what we do.
And how do you go about helping them overcome that stigma? I know that exists, and you have an anti-stigma campaign. But how do you break down those barriers, especially in some of these groups? Again, we're up here in North County, which is the most diverse part of San Mateo County. The groups may not speak English or not necessarily really plugged into what we think of as the service providers.
Yes, absolutely. I'm glad you're sensitive to that. The first level is about education and just help people understand what some of these conditions are, that there's no more judgment about them than there is about getting any other type of healthcare condition, and that there's treatment that's available. So the first part is education, but we also realize there's cultural factors that impact how a person might think about mental health conditions. Some cultures have a very derogatory or negative description. Even the language is negative. And so helping people try to understand that it's a biopsychosocial, affects your, there's a genetic component, there's a biological component, there's a physiological component, there's a nutritional component, as well as your thinking and your behavior. And as people can recognize that these are conditions that are treatable, then we can help them using the culturally appropriate interventions to help them get better.
When you are an Asian American, and how does that, or does that influence how you go about your job and sort of understanding these different communities? Does that, basically make a difference?
Obviously, my ethnic background is a foundation of who I am. And that said, especially in this position and as a psychologist, you take who you are and be able to expand your thinking about that, of course, through other people's perspectives and worldviews. And so both as a Chinese American, I've had a certain understanding. I was fortunate, both my parents are in the healthcare, my father's in the healthcare field, he was a physician. My mother's a child development major, so I kind of grew up maybe been a little bit more psychologically sophisticated. But that said, between my family and friends and people and my colleagues, not all of whom are Asian, have certain stereotypes or stigmas around mental health. So there's a bit of education, hopefully role modeling that I do for them. But certainly that background I bring to that. It makes me more aware and sensitive to other cultures who have different perspectives of the problems that we struggle with and the type of work that we do. So we want to make sure that we're gearing things that are culturally appropriate.
And we hear a lot these days about how stressful living is in the Bay Area, about the high cost of living, commutes are bad, rents are high. Are we just in general seeing more individual stress and anxiety in people? I would think that would be like a foundational behavioral health issue to deal with. Or is that more just perspective because we're all just stuck in traffic, we think everyone is stressed?
Well, stress is just a part of living, so you can't avoid it, but certainly there are certain environments where the stress is more pronounced than others. So for example, in San Mateo County, it actually is very competitive. So as you may know, recently we've had a number of youth suicides in San Mateo County, which has one of the higher rates of suicide among youth among California and in the country. And so we have to wonder what's going on around that and take a look at the different stresses that our young people are going through. I think competitiveness is only one part of it. Also, it's important that families feel supported, that families have a sense of what the resources are and try to have a balanced outlook in terms of what their expectations are of children. Bullying is always a big issue around youth suicide, as is the competitiveness around getting into college.
And how, especially for those younger people, how do you go about reducing that stress or that competition? And actually, I had heard some numbers before. I didn't realize the suicide rate in San Mateo County among youth has one of the highest. How do you go about attacking that problem?
It's difficult because also we have to work with families, with the school system. I'm not saying that everyone has to or needs to come into behavioral health services. A lot of times, especially through their primary care doctor, many people who attempt suicide or die by suicide had seen their primary care doctor, about 80% within that year before they made that gesture. So it's important that people in the school districts, people in primary care, and people in faith-based organizations are aware of what the signs are, know how to talk to people about someone that they think might be struggling, and how to make sure they're getting to the appropriate services. So that's just one level. Another level is making sure that our system is accessible. So right now we kind of require people to come in person into a clinic or into a private practice office to talk about these issues. I think we need to do a lot more reach out using social media and becoming part of the conversation that young people have in the vehicles that they're used to using, whether it be text-based or social media-based.
Is that one of the challenges behavioral health faces, is just being visible out there and being accessible to people so they know where to turn?
Right. Most people think of mental health services or substance abuse as just something that happens for very few people, and it's kind of invisible to the other issues and challenges that happen in a person's life. And it's not that it should be front page news all the time. I appreciate that just recently the Surgeon General was speaking about mental health issues and some of the resources that we're trying to channel to that. So we're very happy to see the leadership around the country recognizing that these are challenges that affect a large part of our communities. It's also important that we are able to, once they are aware of that they have the appropriate ways to access those services. And again, so it's not about having everyone come into a clinic or an office, but to be able to get resources and go online and find what kinds of opportunities are available to them to receive help.
Well, tell us a little bit more about yourself. So you're new on the job. We know you live in the East Bay. You tell us a little bit more about you the person who runs behavioral health. I always like to ask people, the guests on the show, to tell us a few things about yourself that we may not know about you.
It's a little awkward because this interview shouldn't be just about me, but I think it's of interest. Why does a person pursue a career in psychology? Not too many Asian men go into psychology, and most do go into research. And although I started off going into being a researcher, I quickly realized that my passion, my heart was in helping people. So I trained to become a psychologist, to be a therapist. As a therapist, I realized that it was important for me to kind of impact on a larger scale. And so I grew my practice into a regional practice and then eventually merged that with a statewide organization. Really enjoyed that, have an impact on the larger system of care. And so around 2000, when I had my first position in a community-based organization, started working more with the private nonprofit organizations. I think my combination of being a person of color, being aware of the community, having a lot of influence from my parents and my grandparents, and doing that, and understanding systems of care led me into being able to have an impact at the county level. So I think it's a good match for my skills and background.
Well, we're happy to have you aboard San Mateo County. And if people want to access your services or learn more, where do they go?
So we have a website as well as a Facebook page through the healthcare system, and I think the numbers can be provided for that. So we try to be as accessible as we can. We have an access number that people can call and just call up regardless what you think your challenge is, and those folks are trained and very good at being able to direct people to the right resources that they need.
All right. Dr. Young, thank you for joining us on San Mateo County today, and thank you for watching.